Welcome to Hit Show, your go-to source for today's leading healthcare business headlines. I'm your host, Ida Klein. Today on Hit Show, the AMA celebrates hospitals improving physician well-being. 52 health systems push Congress for a hospital-at-home extension, and PhRMA, the Pharmaceuticals Research and Manufacturers Association, launches a campaign around 340B pricing. We'll also highlight an innovative new neuromodulation device, and close with an interview on how providers' mindset around remote patient monitoring is changing. We start today with recognition for hospitals working to improve physician well-being. Teresa Vaughan has the story.
The American Medical Association has recognized 109 hospitals and health systems with its Joy in Medicine distinction for the 2025-2026 award year. Awards range from gold to bronze and highlight organizations making measurable, system-level progress in combating clinician burnout and improving physician satisfaction. The AMA says it's not about wellness perks. It's about addressing structural drivers of burnout, from workload to workflows. Gold-level recognized health systems ranged from Advocate Health to WellSpan Health, and from Permanente Medical Group to Ochsner Health. Jefferson Health, Dayton Children's, Mayo Clinic were among the 20 systems honored at the gold level.
How should executives view this distinction, Teresa?
Ida, it is becoming a marker of organizational culture. Leaders who prioritize clinician well-being not only improve staff retention, but also strengthen quality and patient experience.
Congratulations to all 109 recognized systems. Thanks, Teresa. Hospitals are ramping up pressure on Capitol Hill for certainty around home-based care. Anika Shah breaks it all down.
Over 140 health systems and stakeholders, including Moving Health Home, the Society of Hospital Medicine, and major systems like Mass General, Brigham, and Stanford Health, have signed a letter urging Congress to include a 5-year extension of the hospital-at-home waiver in the upcoming federal funding package. Without action, the waiver is set to expire September 30th. Without congressional action, programs currently operating or those planning to launch could be forced to pause or roll back. They're not just sending polite letters. Executives are meeting with lawmakers, making calls, and rallying patient stories to show that these programs work. The push is to stretch the waiver out through 2030, which would give hospitals the confidence to invest and expand instead of operating year to year.
So when could Congress actually make a decision?
The federal funding package is due later this month. In the past, Congress has bundled extensions of the hospital-at-home and telehealth waivers into these funding resolutions, creating short-term extensions, 6 months to a year at a time. These health systems and the other stakeholders are pushing for the Hospital Inpatient Services Modernization Act, which would extend the waiver through 2030 and mandate CMS to complete a comprehensive study on the model's outcomes. If neither of these happen, the waiver lapses, and hospitals could be forced to scale back programs overnight.
And how soon should hospital leaders be preparing for that?
They should be preparing right now. If you're running or planning to launch a hospital-at-home service, you've got to model both scenarios. What happens if Congress acts, and what happens if it doesn't? Without certainty, new investment is risky, and some systems may need to hit pause until the policy picture clears.
Thanks for the insightful coverage, Anika. Speaking of RPM, Jalen Cross has an interview with Rimidi CEO Lucienne to close today's show.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care, their way. The journey toward the summit of healthcare has begun, and through partnerships built on trust, Sunrise is helping healthcare organizations bring next-level care within reach.
Welcome back. You're listening to Hit Show. Looking ahead to next week's Fierce Pharma Week in Philadelphia, we have a developing advocacy story. Logan Stokes has more.
The Pharmaceutical Research and Manufacturers of America, or PhRMA, has launched a new advertising campaign targeting the 340B program. The group argues that markups in the program are distorting costs and hurting patient affordability. The campaign is running ahead of a heated policy season and is expected to be a flashpoint at next week's PhRMA gathering. Hospital advocates counter that the 340B program is essential for funding safety net care and shouldn't be painted as a profit center.
Logan, how does this tie into next week's coverage?
Ida, it is a prelude. Expect 340B to be one of the dominant talking points at Fierce Pharma Week, with lawmakers, providers, and pharma leaders all weighing in. While media is not permitted into the sessions focused most closely on this initiative, we have interviews scheduled with key industry leaders. Listeners can tune in next week to see what we uncover.
Thanks, Logan. Looking forward to it. On the innovation front, a new device is taking a non-invasive approach to neuromodulation. Jade Romero reports.
Parasym has launched Neuropod, the first ear-based vagus nerve stimulation device available in the U.S. that requires no surgery. The wearable has been tested in more than 50 studies, showing effectiveness in reducing fatigue, anxiety, and markers of inflammation. Neuropod is cleared for use as an at-home device, and executives say it opens the door to broader applications of neuromodulation without surgical intervention. Analysts note it could create new opportunities for providers interested in complementary approaches to mental health and chronic condition management.
Jade, how should health leaders view this kind of technology?
It's early, but it reflects a bigger trend, bringing neuroscience into mainstream care through non-invasive tools. If adoption takes off, it could influence how systems think about integrative therapies.
Thank you, Jade. To close today's show, Jalen Cross has an interview about the evolution of RPM with Lucienne, CEO of Rimidi.
Thank you, Ida. RPM used to be that thing you tried with a pilot program or a grant. I talked with Lucienne from Rimidi about why that's changed and what health systems need to understand now. Lucienne, you've been doing this for over a decade. When did you see the shift from RPM being an innovative care delivery model to just how we manage chronic disease?
Through the pandemic, when we saw this embrace of virtual care and sort of normalization of that, it still took probably 2 years coming out of the pandemic for folks to change their mindset from RPM being an innovative technology that you try with a small group of patients, or you do a pilot, or you have a grant, to really thinking about it of like, this is the way we deliver medicine and healthcare.
So when did you know it had become normalized?
So, to me, that was the pivotal shift I've been looking for, is actually for people to stop talking about it as this highly innovative care delivery model and just say, this is how we manage hypertension or diabetes or heart failure as a standard of care.
For health systems still thinking RPM can't break even, you're saying they're asking the wrong question?
And so when I talk to a health system who says, we're concerned that, there's no money in RPM, or you can't break even running an RPM program. And so I'm worried about implementing something that's not sustainable. I really have to have a conversation with them about the why, right? And I think you always have to start with that why. At Rimidi, we're always trying to sort of refocus on that North Star of clinical outcomes and population health impact, and then leveraging payment models as a means to the end.
Bottom line, what's your key message about RPM's future?
I think one message, key takeaway from this conversation about RPM is how it can really impact the reach of their providers to their patients and really extend that reach. This concept of practicing at top of license that we've, discussed a lot in the industry. There's a really important role for technology in that, where technology can help the nurses, the MAs, the physicians, the pharmacists all really have their greatest impact on patients, focus their energy where they uniquely can be impactful, and allow the technology to facilitate that. So technology sort of as a clinical extender, as a workforce multiplier, I think is something that, I'd love for everybody to think about.
When workforce is your biggest challenge, RPM isn't just another technology. It's your team multiplier. Check out the full interview and more at HITshow.
That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you. kimchi.com.